Namaskara. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have the most beautiful and more efficient Dr. Parimala Devi, who has set a world record, Guinness World Record, in screening the cervical cancer. And apart from that, she's good in robotic as well as the colposcopy. Though she is more advanced in the technology, she believes in the roots. And as a result, today she's going to tell us why the health checkup camps and why the free checkup camps and why the healthy environment is very important for the younger generation, because there are so many diseases which are silent killers and they have to be detected in time before it is too late. So Parimala Devi, welcome, and please tell us, throw some light on this.
Thank you, madam. Respectful pranams to you. And I'm very lucky to have some important discussions with your experienced person in front of me and discussing, which will help our a lot of humankind, we can say. This health checkup topic today, we thought of discussing. I actually requested you, madam, shall we just draw the attention of people regarding this health checkup? Because there are so many health checkup papers they bring from there. Madam, you have done the health checkup, you see. Please, you see this report, that report. It is on the paper, but pertaining to that person, what is going on, that we don't know actually. Unless we examine that person, then correlate the tests which are related to them, then only this health checkup is very helpful and very informative, we can say.
I think this is very important, because there was a time we used to examine and then write the irrelevant investigations.
Yes.
But today
Correct.
people are going for the investigations and coming with the
Yes.
pile of big booklet of
Yes.
investigations.
Yes.
And we have to search which is wrong and what is wrong. And that is the wrong. It is like putting the cart in front of the horse. And that is not the correct thing.
Yes. The son-in-law, a good son-in-law is in Bangalore. The mother-in-law is in some Orissa somewhere. She may be some 100 kgs or 120. We don't know what is there. He will get one scan report from her on the post. He wants to really please his wife by showing that report to the mother. So he will come with that report and he will enter the cabin. Madam, see this report and tell whether anything to be done. There will be a big fibroid. There will be something like hypertensive. The weight is this one. Really, we don't know what to tell. That is the time like we have to tell. See, we have to see them and then write the correlating investigations. It's not only just the blood test, some test. For a woman, for example, if we have to see her around 40 years, means she have to undergo general blood test, whether there is any diabetic tendency or any hypertension she has developed, because that's a life journey. She might have developed a lot of stress in her life, bringing up the children, so many things, multitasking for women. I'm speaking from a gynecologist purview. And then we have to see whether on examination is there any problem or anything. Her weight actually, we have to counsel her. Then we have to ask for the investigation. You know, these days we are speaking only about breast cancer, cervical cancer, which is first and second in the statistical order. So we have to draw their attention. If you just do one blood test and see the scan report and send, we are not doing justice. That's what I tell. That's what I tell. We have to screen the breast. We have to screen the cervix by a pap smear. That's the internal organ of uterus. And then the ovaries and all should be seen in the scanning report. And then we have to counsel that lady regarding maybe ನೀವು ಹೇಳ್ದಂಗೆ ಆಹಾರ, ಆಧ್ಯಾತ್ಮ, ಮತ್ತೆ ಬೇರೆ ಏನಾದ್ರು ಔಷಧಿ ಸುಮ್ಮನೆ ತಗೊಳ್ತಾ ಇದ್ದಾರಾ, ಸ್ಟ್ರೆಸ್ ಲೆವೆಲ್.
Okay. Parimala, when you said about the obesity, I realized, when I was in Bangalore Medical College, the PMSSY, a lady had delivered in Vani Vilas and she came with a baby. And the baby looked like almost 5 months or 6 months. And then she was so fat. So fat means 3 times my size. And then I asked her,
5 times, madam. The baby? Your size is 5 times.
No. I asked her, is the baby 5 months or 6 months old? She said, no, I delivered yesterday. I said, oh my God, 6.5 kilo baby you delivered? What a great mother you are. How did you tolerate? I said, I patted her. Did you get the cesarean? She said, no. I had a normal delivery. And who delivers a 6.5 kg normal in nowadays, they will be so scared and they will go for the cesarean.
Correct.
They said, no, madam. All the doctors and nurses, they were sweating and they were struggling. So if they had to just record her weight and get the blood sugar, they could have prevented the bacterosomia and then the big child with the cardiac defect. all that can be prevented by simple recording the body weight as well as the blood sugar.
Correct,
And
correct,
this is
correct,
what we are missing. I think
correct.
you should tell us how
Yes.
exactly
See,
this
when
is
you said about
important.
delivery, I suddenly remembered these days all our clients are their families are Google University degree holders. They will have read
Yeah,
so much in the Google. They will
Google
come.
Guru.
Our apron is nothing in front of that Google University degree. So there is one condition which we are always scared. Many people, like including me, have stopped practicing obstetrics in a vast way because there are a lot of these critical care problems
Litigations and
we come across,
problems.
like postpartum collapse, embolism, these things. When lady starts pushing the baby, especially as you said, that big baby, the amniotic fluid, there is a fluid which is around the baby always, amniotic fluid, that will be pushed back to the cardiac vessels, everything.
Yes,
That may
yes,
create suddenly the postpartum collapse or cardiac
yes,
collapse also. These things we have to counsel them from the beginning only, not to
yes.
scare them. In the beginning of the pregnancy only, we should do a cardiology checkup or at least physician checkup. And just before delivery, we should always bring to the notice whether this condition of the patient is this one, so that they also will feel confident. But all these
I
things
know,
can be
I
done
know.
only if she comes to a proper hospital. So
Correct,
drawing the
correct.
attention, counseling them, doing proper investigations, and leading our women is very important. For example, when I was examining in one nursing home one patient a decade ago, because you are a cardiologist, I love to share this one. She was 50 years. She came for some irregular bleeding, menopausal problem. You have taught us as a MBBS, our students of you, that from top to toe, we have to examine a patient, whatever the problem she or he has come. So I still have the habit of putting the stethoscope, seeing everything, seeing the eyes, seeing the tongue, everything. Then when I just kept the stethoscope on the heart, even though I'm a gynecologist, I saw something wrong in her heart, murmurs or some sounds. Immediately, I rushed to the next door cardiologist. It was found to be something like an aneurysm or some operative condition.
Hmm.
They operated, they saved her. She was silently getting into her death trap,
Correct.
actually. Now,
Yes,
also, I
yes.
meet her. She folds her hand and says, Madam, my lifespan is given by you. Like this, health
Yeah,
checkup means our women should not be scared. Oh,
correct,
Tashna.
correct.
As soon as we go, they will catch hold of us. They will tell something and they will try to make money. This notion,
That
this
is
one, what to say,
wrong.
myth is very much
Absolutely
in our
wrong.
people. It
Very,
is
very
not
wrong.
so. It is not so. Think and go and discuss with your doctor. What is your health status? How is your condition? What you can do? Whether you can take some tips from our Madam Vijayalakshmi Madam about Adhyatma, Arogya,
No,
and
no, no,
Ahara.
no. Here, I would like to tell, from Jaydeva Institute, our professor, Dr. S.T. Yavgan,
Yeah.
is to conduct a
Mm.
healthy,
Yes, I
free heart check,
am.
free heart
Yes,
checkup camps all over the state. And we used to
correct,
detect so many people. And
correct,
previously, when the previous government was there, the free heart checkup was there for all the school children. And that
correct.
was, and I myself, I did the low blood pressure truth or myth. And that time we saw that our gardener, a 22 years old gardener,
Oh,
he had a coarctation of aorta and the BP was 220 by 140. And he would have had a cerebral
mm.
hemorrhage and died, or the
Yes,
coarctation would have ruptured. And then, we
correct.
brought him, and the first case in the whole state of aortoplasty. Without surgery, we did the
Ah,
balloon dilatation. And then later on, he got married, he got the son. And after the 2 decades, he came and he said, Amma, bless Manu. And then, a very handsome boy is with him. And it happened to be the boy and his son. And he had got
the
seat in the
child.
medical college. And then now he has passed at MBBS and he's preparing for his post graduation. So that
Post
means,
graduation.
by if we hadn't to check up or the blood pressure,
Yes,
and it would have killed him, and his whole
killed him.
family would
Correct,
have been ruined. I mean, now he's leading
correct,
a normal life, near normal life, and that is a good thing. And apart from that, I
correct.
remember one lady is the full term pregnant, but before
Ah,
going for the delivery, she started
mm,
hemoptysis, coughing out half a liter of blood
okay.
every day,
Mm,
and
mm.
she had a pinpoint mitral stenosis. And then we took emergency, covered her abdomen, took care of the baby, and then did the balloon dilatation, saved her life, and she delivered. But in the past, if
Yes.
such a case had to happen, they would say that the baby has brought the ill fate, and then because of baby, the mother died.
Yes.
You know, these sort of
Mother
notions
died.
should be taken away, and they must come
Yes.
in time and get checked. And if they
Yes.
don't come, it is our duty. Like, you know, if Muhammad
Yes.
doesn't come to mountain, mountain has to go to Muhammad.
Mountain have to
So
go.
all
Yes.
the
Yes.
all the doctors, they must make it as a habit, either to their school or their native place. They must go once in a month and
Yes.
have a
Give
free
there some
checkup camp
yes.
for all the people, you know. So that way,
Yes.
Swartha, Paramartha both can be done. Yeah.
Correct, correct. That is true, madam. So prevention requires only some
Thank you.
penny. Whether it's the treatment requires lot of pounds. That a penny wise, pound of foolish like that we should not do. They should really understand the health checkup, not to get scared about it, that we are trying to care. So they have to use their intelligence, and they have to approach the proper medical person, and not getting directly themselves and getting it offline, some test, and thinking that they have a bad disease and honestly losing their peace. So thank you very much, madam, for giving this opportunity. Because in this, I was a little selfish. I knew you have so much to tell. Now this time is not enough for you. So much of your experience. We wanted to hand over to our public so that they will understand what is this health checkup. Instead of getting scared and sitting in the home, thinking and imagining, they will come forward and use intelligently their money, and they will get it checked up. Even government has a lot of health checkups. They can make use of it. That's what I wanted to share today.
Yes. Thank you very much, Parimala Devi. You have a real social concern, and the way you are dedicated. I hope the next generation, may your tribe increase, and they take a leap from your life and then do as much as free services, so that, you know, either go to their villages or the school they have studied, and then contribute at least few hours in their lifetime in a month, so that, you know, we pick up the cases in time and they can be treated in time. Because be it diabetes or hypertension or high cholesterol or thyroid or kidney or any of these diseases, you know, instead of getting as a
Lifestyle
rheumatic heart
diseases.
disease, instead of having an a surprise at the time of delivery or at the time of hospitalization, and before it is too late, you know, if they come in time, it is better. So better to pick them up in advance, so that we can give a better treatment, so that the whole thing can be prevented. All the complications can be prevented. A stitch in time saves life, and that has to be remembered.
Correct.
And thank you very much for your such a beautiful.
Thank you, madam. I enjoyed this conversation and learned a lot. Thank you, madam. Thank you so much.
Thank you.